Hi, this is Pamela Worth from Encourage Your Wellness podcast. And today I have Chris and Eric Weiss, physicians, and they have an amazing story as well as are helping so many people with their treatment plans. And so really happy to have you here today. So thank you.
Thanks for having us.
Thanks for having us. Great to be here.
So tell everyone a little bit about your journey and how you've learned so many different things. And where your focus is today.
Yeah. Okay. Well, our journey is that we have a son who's autistic. It started probably at 13 months, and we knew we had two other sons who are older, and we knew that something wasn't quite right with him, and this took us on a very long journey of educating ourselves and our son. You know, at the time, there wasn't Google. This was 1995, and, you know, everything was using the phone and dialing up people, you know, that we knew from the medical field and whatnot. And it ended actually quite well. You know, he's doing very, very well. He lives on his own. He is independent. He drives. He has a job. But in between, we had a lot of therapies that we did that helped and things that didn't. And in the meantime, we both wrote a book on our journey. And we knew that we were the peak of autism because at the time our son was diagnosed, it was 1 in 10,000.
Mm-hmm.
1 in 10,000. And now it's, depending on where you look, 1 in 25. So it's an explosion. And I just felt that we were in the beginning of this journey and that we had to help those behind us. So we sort of did a blueprint of what we did to help our son and wrote this book for the people that moms and dads that are looking for answers.
You know, I think as a physician, you know, usually we know how to treat things, you know, and, you know, God forbid, but if your son or daughter gets leukemia, you know, the pediatrician knows what to do. You meet with a pediatric oncologist, you talk to the radiation therapist, you talk to the chemotherapist, and it sets you on this conveyor belt of treatment. And there's a beginning of treatment, there's an end to treatment. It may end up with a bone marrow transplant. Nobody knows, but they know the game plan. And when we were told our son, you know, was on the autistic spectrum, there was no game plan. You know, they didn't say get speech therapy, get this, get that, you know, go to this website. None of that was available. And so it was a trial and error, trying to list our son's strengths, his weaknesses, where he needs help, and then trying to look into what is listening therapy, what is visual therapy, you know, what is, you know, floor time, you know, and all these things. And Chris kept detailed notes, and you know, her job was to kind of find the therapy. My job was to vet it. And you know, we reassessed every 3 or 4 months. Is this something that's helping our child or not helping? Do we think we can see a benefit or no? And the culmination is the book, to give, you know, parents, you know, not necessarily a blueprint or a guide, but at least reference material. Because Chris, you know, at the end of every section, there's notes, there's highlights, there's web pages, there's phone numbers, there's things that you can call, you know, looking for help.
Which I think is incredible. And I think so many people just need to understand where to start looking, where to start asking questions. Who can they trust? Who can they not trust? Because there's so much information out there, and some of it's real and some of it's not. First of all, what's the name of the book?
Educating Marston. Marston is his name. So it's called Educating Marston.
It's on Amazon. It's on, you know, Barnes and Noble, any place you want to find a book. But it's essentially dedicated to him. It's what we did to get him where he is today.
So he's now in his 20s, right?
Correct, 28.
Which is awesome. And you've also been doing stem cell treatment on him, correct?
That is correct.
So tell us a little bit about that, because there's different types of stem cells, and you don't know, again, that's a whole journey in itself, which stem cells can you trust, where are they from? And some people say it's illegal and some people say it's not. And it kind of depends on whether the type of stem cell, if you will, and where it came from. And would love for you to touch on that.
Yeah, exactly. I'll answer that since I'm kind of involved in that.
And you can say the 3 chapters.
Right. The middle 3 chapters of the book are all on stem cells that I wrote, kind of a basic knowledge and understanding.
It's in layman's terms, so it's a little easier to understand, not quite
too medical. But to make a long story short, there's basically 2 types, broad categories of stem cells. There's embryonic stem cells, which come in from an embryo, and there are things that embryonic stem cells are used for. But these stem cells are derived from aborted fetuses, which obviously has a lot of moral and ethical issues and are frowned upon by many of the churches. And then there's adult stem cells. And adult stem cells are designed to heal. That's how our bodies heal. Every cell in your body has a defined lifespan. So when a muscle cell reaches the end of its lifespan and dies, there's a stem cell close by that makes another muscle cell, so you don't lose muscle mass. And so that's how our body works. And there's a different type of stem cell that makes a muscle cell versus a liver cell versus a kidney cell versus, all these types of things. So the type of stem cells that treat autism are adult stem cells. They come from live, healthy birth babies. They come from the umbilical cord and the umbilical cord blood. So, 99% of all umbilical cords and umbilical cord blood are thrown away every day. A few women and our families decide to bank their cord blood and bank their cord in case their child ever needs some type of healing. But these cells that are found in umbilical cord blood, there's 5 major stem cells, and they've been shown to exert tremendous healing capabilities. And since they're so new, even though it's a birth, it's still an adult stem cell, because about halfway through the second trimester, the baby's no longer forming. It's just growing. It's kind of a completely formed individual. It's growing. So the embryonic stem cells are gone. Now we have adult stem cells. And so they've been used in a lot of healing, for a lot of different things, from diabetes to knee arthritis, to the leukemias and lymphomas, all sorts of things. Umbilical cord stem cells are new to autism, but they're not new to medicine. They've been given therapeutically for over 60 years now.
So it's like a repurposed drug.
Correct. So we'll touch on that later. But what was found out was that autism, the vast majority of children with autism probably have neuroinflammation. This was an autopsy study that they did on children with autism that died from other causes, from house fires to drownings to car accidents, etc. And when they looked at their fresh brain specimens, they all had brain inflammation. And due to other research, mostly in the traumatic brain injury side, it was found out that the mesenchymal stem cell, which is one of the stem cells found in umbilical cord blood, can turn off brain inflammation. And not only turn off brain inflammation, but turn on brain restoration, which means turn on new growth, new connections, which can really start healing. And so the first thing, the landmark paper came from Duke in 2019, but before they looked at autism, they did cerebral palsy, because cerebral palsy is also an inflammatory disease. And what they showed is that these children that got umbilical cord blood, 90% of them, their cerebral palsy got better. Then they repeated it with autism, and about 60% of the children got noticeably better, significantly better. And there were objective testings. They had new connections in their brain. They had, more energy on their EEG, stuff that went from abnormal to towards normal. And so that's the basis. Getting back to what you thought about legal versus illegal, and that's a big, source of disinformation in the United States, that the FDA regulates drug companies. They don't regulate doctors. And so umbilical cord blood is given for almost 80 different diseases. So it's kind of on the U.S. formulary. It's a substance. It's a product that's available. Is it FDA approved for autism? No, not yet. And there's people who are working on that. specifically Duke and other pharmaceutical companies. But the fact that it's on the formulary, I can get it, and other doctors can get it too. Just like ivermectin was kind of repurposed from river blindness to COVID. Latisse, which a lot of women know about, which grows eyelashes. That's a glaucoma medication. And it was just noticed that your eyelashes grew when you put the drops in your eyes. So it's available. Not a lot of doctors do it, but it helped our son so much that my wife, convinced me that this is something that, I need to do. And I'm a surgeon, and I, started giving up surgery and starting, helping these children because it was night and day for our son.
Wasn't easy to convince.
Yeah, I tried to tell her I had a day job. I was busy enough, but it's a tremendous amount of healing can take place. Unfortunately, it's not everybody, and it is expensive. I'm not here to minimize that, but it can be the difference between night and day.
Well, I think that's amazing. My mom has stage 4 cancer, and she's had 90 days to live for little over 5 years. And
wow,
that's a long 90 days.
Yeah, so she's been getting stem cells as well, and through an IV, and that's been helping her body heal, which has been pretty amazing. Do you find
what are the differences she feels?
She has energy. She has an appetite. She,
nice.
And the cancer is not growing. So.
Nice.
What a lot of people, we all talk about the stem cells that are found in umbilical cord blood, but there's a really cool cell that nobody's probably ever heard about. It's called a hunter-killer cell. And umbilical cord blood is chocked with hunter-killer cells.
Right, and it helps her NK cells grow as well, which is...
Yeah.
Right, exactly.
Those are the same cells.
Yeah.
And so those seek out and destroy malignancy.
Yeah, which is pretty awesome. So for you as a doctor, you now will also give people stem cells for certain things that they need. Do you have a certain protocol that you follow? Is it all people that would like stem cells are allowed to come to you and get them, or is it certain instances?
Well, I like to practice evidence-based medicine. And so there's not that many great studies out there where they actually studied it. Mm-hmm. Certainly, protocols are published, but nobody's really ever looked at, is one better than this? How do you do it? So I went to Duke, and Chris and I met with the people up there, and we kind of talked to them about it. So I used, essentially the Duke protocol. Mm-hmm. And I try to keep up with the reading. For the people that get it, I try to ascertain is if they're a good candidate. I don't want to just, take the money. So children with, severe genetic abnormalities, let's say there's Rett syndrome and something called Rick syndrome. There's XYY, there's Fragile X. There's a lot of different genetic abnormalities that are lumped into the autism diagnosis. And if it looks like they have that, then it might not be a neuroinflammatory disorder. It might be a genetic disorder. And so there's really no good studies on children with genetic disorders. So I kind of say, let's wait and let the science catch up and see if, there's something we can do.
And so if someone is thinking about doing this, how much does it typically cost? And I would imagine that it needs to be over a certain time period for a year or two, because it takes the body so long to kind of catch up and start healing. Nothing's automated, and you might think it's not working, but it really is, because it's such a slow process for the body to kind of turn itself around.
Correct. Because you essentially have to make new connections in your brain. Yeah. If you think of a child that's nonverbal, when he becomes verbal, it's not a light switch. The inflammation gets treated first, then they have the ability to speak almost. So then it's almost like a newborn. They have to start, listening and hearing and babbling in words. But the Duke study showed that they started to be able to measure progress at a month, and it continued to increase for 6 months. At 6 months, it plateaued, but it never went down again. And that kind of means that, new connections were made and things like that. And so I try to be upfront with parents, and their protocol was based on weight. And so the weight of the child, in about 1 to 2 million cells per kilogram. And I think that, most kids are probably in that 20 to 30 to 40 to 50 kilogram range. So it's usually 1 to 2 vials, sometimes 3, and that can range from $4,500 up to $12,500. And I know it's pricey, and I don't mean to poo-poo it, but when I took my son to the University of Illinois Chicago, it was $20,000. And I think the good thing between us is that I don't have to make money doing this. I just have to not lose money. I have a good surgical practice that pays the bills. I do it out of my office. I use my same nurses, so it's not that big of a money sump, except for the product itself. And so we try to offer it as the most reasonable thing we can.
Pretty awesome. So if someone's thinking about doing this, what sort of questions should they ask? How would they know the source of the stem cells, or how would they start to understand or verify if it's any sort of research or thoughts around any of that? Obviously you've been doing this for so long. I'm sure there's good places and not so good places and unknowns and all kinds of things that maybe somebody says they're giving it to them, but maybe it's something different, and how to find a trustworthy source.
That's actually a great question. Yeah. And a lot of parents ask that question, and we want them to ask that question, because where we get our stem cells is the best. I mean, they have the highest viability. We've actually gone to the lab, for our son. We went to the lab. I wanted to see that it wasn't in the back of someone's garage. I got to see it, look at it. And we met the man who runs the lab. It's an amazing, but you can tell about the lab.
It's the lab. The headquarters are in California, but the lab itself is now in Las Vegas. And I think it's pretty interesting they moved to Las Vegas, because there's more direct flights to Las Vegas than anywhere else, probably in the United States. And so that when, a woman has a baby and she donates her cord and blood, it's a quick flight to the lab, because the blood in the cord has to be there within 48 hours, processed and then frozen. I think you would vet it, any lab, just like you would vet, almost anything. You see who runs it. Is it doctors? Is it the United States? You can ask them where they get their stem cells from. I always tell everybody where I get my stem cells from. My lab is in the United States. They only take, donors from the United States. All the donors are screened genetically, as well as for any type of infectious disease. The lab maintains good manufacturing processes and good tissue processes, which is very difficult. They're accredited by the FDA. They have a full compliance division. It's a first-rate organization. They hold patents on, transport, packaging, processing, and so they do have good viability. But I think you just call and ask. Anybody who comes to me, I've spoken to on the phone. They usually call the office. I send them some information, but I try to speak to them plainly, because parents are, freaked out a little bit.
I mean, we were freaked out.
Right. I didn't want to go to Panama. I didn't want to go to Mexico. And that's not to say they're not, great organizations. I called them. I spoke to the people in Panama, and they just didn't have much experience of treating kids over the 18, and really didn't treat kids over the 18. My son was 22, but the landmark paper that described the brain inflammation, they had a person as old as 44, and they still had brain inflammation. So to me, it's all about talking to the medical director or the head guy, and just find out what the plan is, and vet them as you would if you were going to get heart surgery. What do they do? How are they trained? What are their thoughts are? I send my patients papers. I go, this is my thought process. Here's 6 papers that you can read, which I base my decisions on.
And also, one of the reasons that it's expensive is because they test, the mom, the dad, for all these genetic testings. And really, I think it's 1 out of 9.
Yeah, 1 out of 9, 1 out of 8 gets accepted.
So they still had to test, all 9, which is a lot, is very, very expensive.
And they've processed all the blood.
They've sent it there. They've done everything. but really only 1 out of 9 is accepted because it passes all the genetic, all the HIV, all the testing that has to be perfect. So that's why it's expensive too. And then it comes to our office as a transplant. It actually is in
dry ice,
minus 80. We had to get a refrigerator that's minus 80 to store it. And, that's expensive to ship it that way. And, so there are just certain things that you can't, that are going to cost that much, no matter what we do.
And so do you find then that, so when someone comes in, do you do it through an IV and then do you do it once a month, like the entire sitting, you get the whole thing, or is it over a period of days, or how do you?
Yeah, I do it all at once because that's kind of what Duke did. Their initial study was a one-shot deal. There's never been a study really that's looked at multiple doses. People need to remember this is in its infancy. The first description that these worked in autism was, came out in like the summer of 2019, followed by the pandemic, which nothing happened. There were no follow-up studies. So the next round of studies is essentially just has already started. And a good study takes about a year or a year and a half. And so we're progressing. Duke has some studies that are finishing up, I believe in January or February this year. But the United States, a phase 1 studies, it's safe, and that's been done. A phase 2 studies doesn't work, and that's what they're doing now. A phase 3 study is dosage and administration, and they haven't really started to work that out yet. And then a phase 4 study, is this better than anything currently on the market? Well, a phase 4 study doesn't need to be done because there's nothing currently on the market. And so people are gathering tremendous amounts of information right now. And not everybody's doing it. It's just a handful of medical centers.
And then do you find that people come back once a month for, say, 6 months, or how often?
I try to, that's the big question, is how often, especially when somebody starts talking, or, I've had kids that went from not being potty trained and not having, normal bowel movements to within 2 weeks of the treatment, being completely potty trained and having normal bowel movements.
And speaking.
And starting to speak, right. And so the Duke study, and these cells are designed to last in your body 3 to 6 months. They don't last long term. That's another thing, is that people think these cells go into your body and live. Maybe they'll make cancer, maybe they'll make something. That's not the way they work. They're as Chris says, they're kind of generic cells. They don't have self on them. So unlike a kidney transplant or a liver transplant, they don't need to be typed. However, as the more they divide and the more they work, the more they express self, then the more your body clears them. So they're gone at about 6 months. And so I think it makes sense to treat at 6 months, maybe as early as 3. But I don't think there's I don't want people to throw good money after bad. I want to say, let's give it 6 months or so. If we see something that's happening, then let's consider doing it.
Mm-hmm.
Maybe.
And it really is simple. I mean, there are, when you have an autistic child, they're scared anyway. They're coming into a new environment. We know all that because we've lived it. So we have trained, nurses that this is all they do for us. They know what to do. They can calm the child. We have sedation if they need sedation. If they don't, we have is she a nurse?
So she's an emergency nurse, but all she does is the pediatric IVs.
Yeah,
so.
She just does pediatric IVs, and this woman can come in and boom, she gets it almost every time. And, we want it not to be a crazy, scary experience for the mom and dad and for the child.
And for us. It's hard to hold the child down and, give them an IV. As a surgeon, if I have to sew up a child in the ER, I'd much rather sedate them so I can, numb them up and just sew them up calmly instead of, holding them down with one hand and sew with the other.
There are some kids that we just have to numb up their arms.
There's a lot of children.
And they're really good. They just stick their arm up, we numb it up, and in an hour, they're done, and that's it. So
totally separate, but I would imagine that you also talk with people about other things like making sure they're not eating too much sugar or something, because then that can.
Right. Well, that's what I mean,
She's a dietitian.
I'm a dietitian by trade. And so the best thing is to clean up the gut. That's the number one thing, is to really clean up the gut, let these kids, get off sugar and any kind of, wheat or
milk,
gluten and milk, get them off all that and get them as best they can. So when the stem cells get there, it's not just cleaning up the gut. It's, going, because the cells go to the most inflammation.
They migrate to inflammation.
So if they're going to just go to your gut and then someone says, well, I really didn't see a huge difference, maybe it's just because their gut was so bad at the time.
But they usually see an improvement in the gut symptoms. And in fact, we have a child like that who just had terrible gut issues, constipation, alternating with diarrhea, bloating, very skinny, didn't eat. And within 2 weeks, it was night and day, this, potty trained, normal bowel movements. But the cool thing is he gained about 30 pounds, because eating didn't hurt anymore. He was still, essentially nonverbal, but his father was actually a physician, or is actually a physician. And so, I just said these things migrate to inflammation. And maybe now that we checked the box on the gut, let's try it again in 3 or 4 months and see if we can't stimulate the brain.
That's awesome. Is there anything that we missed? Anything you want to touch on?
Just that, I don't know. I feel for, we're part of this club we never wanted to be, parents of autistic children.
Right.
And,
it's a long game. People, that's what I learned. It's a long game. You can't just give up, when one thing doesn't work. You have to go the distance, and the reward is at the end. You have to really work hard with these, investigating what's out there, making sure they're like you said, legitimate, whatever therapy they need, because there's a lot of snake oil salesmen. At least when I was out there were, and don't just go to traditional medicine. Make sure you're going to, look at.
In fact, I think traditional medicine may not be your best place, because a lot of times they just say, it is what it is.
That's what we saw, but there are great people out there, but that's what we saw. So we looked at alternative things, and that's how we found stem cells, because we were, looking at alternative things out there, and that's where we found,
I think too, the one thing I wanted to mention is there's a woman, a Dr. Weathersby at Florida State. She has a website called autismnavigator.com, and it's an amazing website. And for people, especially people in rural places, or people they don't seem to have, maybe a pediatrician that specializes in a neuro, psych person, you can upload videos, and her whole team will evaluate your child and then offer their input on where to go, how to help. And she's a pioneer in early, intervention and early diagnosis. And she's, diagnosing kids, around 2 years of age and even a little younger.
6 months.
Yeah. So I would highly recommend that, I think, because you just get another pair of eyes in a woman who's devoted the last 20 or 30 years of her life to looking at this and helping many families. And so she would be something I would just happen to mention.
And we have it on the website.
Yeah, I think my website, educatingmarston.com, or even North Florida stemcells.com, has a link to the Autism Navigator, because I really believe in that. And then the last I would say is their life's not your life. And I think that we had a problem that, our son was never going to go to high school and prom and, college and things like that. But I can tell you he's happier than he's ever been. And he's living a complete life. And, he has friends. Is he doing what we kind of foresaw? No, but.
Right. Is he perfect? No. He still has, some gaps, but he's way better than I ever dreamed in my life that he would be. I never thought he was going to be driving a car. I never thought that he would have a job where he does very well. And I never thought he would live on his own. So, he's made these, this progress, and it's amazing. And I just want people not to, give up. There are people out there who are just like you and I, who are looking for answers, and there are answers out there.
Amazing. Thank you guys so much. I really appreciate you sharing your journey and another way for people to get help and to help themselves as well as their families. And so this is fabulous.
Well, I think this can be cured somehow.
In our lifetime.
Yeah.
Thank you both so much.
Thank you.
Thank you.